Good afternoon, everybody. Today I wanted to talk with you a little bit about animal-assisted therapy. As you know, this is something that's very close to my heart because Gabe, the magical dog, is working on being a therapy dog here at the practice. So I guess I wanted to begin today by saying, what is a therapy dog? So a therapy dog is an animal that's been especially trained to be used as a tool in a therapy session, usually by a psychologist or a counsellor or a social worker or something like that. So when we bring the dog to work, we're not just bringing the dog to work so it can sit there and you can pat it and stuff like that. I mean, of course you're welcome to do that, but training a dog to be a therapy dog is actually quite an involved and complicated process, and there are a number of steps that you need to take. The first step is to understand all the boring stuff, but it's very necessary around OH&S. So of course we need to understand that the dog needs to be temperament tested to make sure that he's going to be okay with children. Especially here at our practice, we work with children that have a range of little behaviours that they're trying to work on, like anger or shyness, confidence, anxiety, things like that. So we need to make sure that when they're interacting with Gabe, the canine that we work with at our clinic, that they're going to be safe and that also he is going to be safe. So temperament testing is really important. Your vet is also essential in signing off to say that the animal you're going to be using for therapy is has passed the temperament test. The other thing that's really important with the OH&S too is to understand that there are diseases that are communicable two ways. That is, there are diseases that sure we can get from the animals that we use, and some of those things might be if the dog has fleas, for example, maybe fleas might come into the counselling room, and of course we don't want that to happen. But just like there are some things that we can get off the dogs, there are also some things that we can pass on to dogs, such as things like colds and flu and things like that. So before and after a counselling session, using the therapy dog, what we encourage everybody to do, or it's a requirement actually, is that I will take an antibacterial wipe and I have to run it over Gabe's coat, and I have to run it over Gabe's feet and around the side of his face. Also have to use antibacterial on my hands, and the children that are going to be working with Gabe also just need to apply some antibac to their hands as well, and hopefully that's going to keep everybody nice and safe. Sometimes children and even adults might feel really nervous around a dog, and that's okay. Maybe that's the thing that they want to work on while they're with us, and they're able to do that in a number of ways. So first of all, what we might do is talk to the child about their fear around the dogs, and try and find out a little bit about what's behind it, and figure out a stepped process to help expose that child to eventually interact successfully with the dog. So maybe one of the steps, for example, might be just having a session with the child. The next session might involve having the child and the dog in the room, so maybe Gabe might be there. And what we do is we don't let the child touch Gabe. The child probably wouldn't have any desire to touch Gabe anyway. But what we might do is something like show the child funny videos of Gabe, and I have plenty of them. We might also tell the child some funny stories about Gabe that maybe the child can relate to, like things that they've got in common, like maybe about trips to the doctor or their school adventures and things like that. The other thing that we might try and do is perhaps I might dress the dog up for them. So thank you very much. So maybe Gabe can be dressed up, and now the child will see me do that, and then that might make them feel a little bit more comfortable. They might get Gabe to do some tricks for the child, and this might make the child feel a little bit more comfortable as well. Follow-up sessions might involve the child perhaps engaging a little bit more and being a bit more interactive with Gabe. And so what we might do is perhaps teach the child how to provide a command for Gabe. So maybe, for example, we might encourage that child, if they're quite shy, to get Gabe to sit. So one of the ways we might do that is we might just let Gabe sort of walk around the space. We might teach the child, okay, you want to say stop, and you want to say in a firm voice, in a firm way. Eventually, with a bit of encouragement, the child's going to do that and get a good response from Gabe, and Gabe's going to sit. This is going to help the child feel a little bit more confident almost immediately. There are other things that we can do as well. For example, we have things like this. So this is just a dog treat puzzle, but it's really fun. You can get the child to set up all sorts of puzzles, and we put treats in them, and then the child sort of sets it down and then watches Gabe try and forage and find the treat, and we can time Gabe and things like that. And then the next time the child comes, we can see if Gabe can beat his record and see if he can remember where the treats are hidden and how to get them out. So there are lots of different ways that animals are used to help children who perhaps don't really get the same response from interacting with adults as perhaps they do from animals. So as I mentioned before, there are ways that we can let the child observe until they're feeling confident enough to be able to interact. We can teach the child about stories, share funny videos and things like that. Then we can teach the child how to interact with Gabe. One of the other things that's really helpful, and another way that we use Gabe as a tool in counselling, is to thank you very much, Jamie and Jessie. It's really nice to have you join me today. Another way that we can get the children involved is to use narrative. So for example, one of the little girls that we work with at the clinic has to go to the Royal Children's quite regularly and have IV drips, and she doesn't like it at all. She's absolutely petrified of needles and often requires sedation in order to be able to have the treatment that she needs. So, we've decided that maybe using Gabe could help her build her confidence so that then she'd be able to be less traumatized when she had to go to the hospital. And one of the ways that we did that, hey Frank, thanks for joining. One of the ways that we did that was by talking with her about Gabe and his experiences having injections and being in hospital settings. Because for those of you who don't know, Gabe was, he was a little rescue dog, and he was very mistreated before I got him. And so he was having a lot of trouble himself going to the doctor or to the vet. We tell the kids it's a doctor. And so we had to use lots of strategies. And now we're able to talk with the children, once they've established a relationship with Gabe, about how he handles it. And then maybe we talk to them about breathing and things like that. And then we can get Gabe to lay down as if he's going to sleep. Gabe is at rest, he's laying down on his side, and the children, we can take their hand and we can put their hand on Gabe's belly, and they can feel Gabe sort of breathing slowly, and they can feel Gabe's tummy going up and down and up and down. And when they've got the hang of that and they understand the rhythm, what we can then do is encourage the child to put the hand on their own tummy and feel their own hand going up and down, up and down. So they're sort of learning through the dog how they can use some of the strategies that he uses to cope for them to deal with real life situations that might otherwise be quite scary and traumatic. So with this particular case that I'm talking about now, this little girl now is able to go to the Royal Children's Hospital and have her IV. And she's not as terrified as she used to be. It's still not a pleasant experience, but we've done other things. We've given her a little teddy that's a dog, kind of looks like Gabe. And so she takes that with her, and she remembers about breathing, for example, and that's one of the strategies that she's able to use now. And had we not had, hey Frank, how are you going? Had we not had that interaction with the little girl and with Gabe, then none of this would have been possible. Jamie's just saying, we are training our own Labrador puppy as a therapy assistance dog, and the positives are amazing for all of the family. Oh, Jamie, I'm so excited for you. I would really love to see a picture of your Labrador puppy and hear about the training that you're going through as well. Gabe absolutely loves training. Some of the tricks that we teach Gabe to help with interaction are things like basic obedience. So of course he needs to be able to sit, stay, things like that. He needs to come when he's called, and he needs to stop. But there are other things that he does too. So we play a little game with the children, and Gabe called peekaboo. You know, I'll cover my eyes and I'll say, "Where's Gabe gone?" And then he'll come to me, and you know, he'll jump up on my lap and say peekaboo. The kids love that. One of the other games that Gabe learned last week was the bang bang game. So we've got a couple of boys that we work with, and now what we're able to do is with this particular trick, you know, I'll wait for Gabe to sort of get my line of vision, and I'll say bang bang, and he'll pretend that he's dead, that I've shot him with a little pistol, and then he'll stay there until I give him the release command, or until the child gives him the release command. Then he'll pop up and we'll give him a big pat and tell him he's a good boy. So it's really interesting to see the repertoire that the dogs can learn for their tricks. And as each new child wants to participate in therapy with Gabe as a tool, you know, we need to learn new ways of getting Gabe to interact with that little munchkin, so that they get all the help that they need in a very supportive, a very safe, and a very caring environment. Currently in Australia, there's no federal or state regulations regarding animal assistant dogs, or pets as therapy, as they're called in New South Wales. However, guidelines are being released next year, and I know this because my trainer is actually part of the board that's making up those guidelines, and I understand from her that they're going to be rolled out around mid next year, mid 2018, which is really exciting as well. So anyway, I'm not an expert. I'm just sharing what I've been doing, and sharing Gabe's and my experience in training him as a therapy dog for work down at the clinic in Frankston. But if you have any queries or any questions or any comments at any time, just let me know. And thank you so much for joining today. I can't wait to hear, Jamie, about how you're going with your Labrador, so please keep me posted. Have a lovely afternoon, everybody. Bye.